Good afternoon. My name is Dr. Guyton with SouthernMED Pediatrics, and today we're going to discuss the first of a three-part series on seasonal allergies, asthma, and eczema. With it being springtime now, we are fielding a lot of visits and questions from parents and caretakers regarding allergies, and so we just want to take a brief moment to walk you through some of the common questions that we see. So let's get started. First, one of the most common is, what are the causes of allergies? Well, here in the South, we see a fair amount of things. The first being your pollens, typically associated with trees, grasses, and ragweeds. Secondly, molds and fungus. We don't necessarily think of those a whole lot, but particularly when we're having heavy rains and such, we will begin to see more and more of that. Thirdly, dust mites within the home can be a significant issue. Smoking is another that is typically a natural irritant and allergen. Also, animal dander is very common. Some of the less common things we see are, of course, your foods and your insect bites and stings, if you will. What age does it start, or allergies start? Everything you read is going to roughly say 12 months of age for the start of environmental allergies, but from a food allergy perspective, which we won't cover today, can be at a much younger age. And so, of course, if there's any concerns there, you want to follow up with your primary care provider regarding food allergies. How do I prevent allergies in my child? Well, first off, avoidance. Now, I completely get it and understand we don't want to live in a bubble. We want to be able to get out and enjoy the outside and get our kids out there. But sometimes when we want to open up those windows and open up the house, it may be a better idea to keep those windows closed, keep the outside and the inside in. This will cut down on some of the pollens and things that tend to collect in the home. Additionally, routine house cleaning. Trust me, I've got 3 kids at home, and so my wife and I can certainly find it challenging to do a deep cleaning on the house routinely, but it certainly, the more you can do, the better. Additionally, hypoallergenic is a big buzzword, and so essentially what that means is trying to contain as many allergen sources if you can. So trying to put covers over mattresses, trying to go with synthetic materials, being wary of the stuffed animals and keeping those clean and washed on a routine basis is very helpful. And lastly, eliminating any smoking around the child. And so if there is someone who smokes in the home, we ask that go outside, put on an overcoat or a large shirt, and then when you're done smoking, take it off and leave it outside before you come in. How do we diagnose allergies? Well, the most common way is clinically, quite frankly. We hear the story of the parent and the child and how history has been with regard to previous years. Family history is also very important, and so 60 to 70% of the time there's going to be a parent who has had some sort of issue with allergies in the past. As far as physical exam, we can see a few things there. We can actually see some darker circles under the eyes, known as allergic shiners. We can see Morgan-Denny lines, which are little extra lines right below the eye. And then we can also see a thing called the allergic salute, which is where a child continually rubs their nose and they create this little crease right here called the allergic crease. And so very common to see those things. Lab testing certainly is possible, and it exists in 2 forms, a blood test as well as the traditional skin prick test that you may have heard of. And of course there's advantages and drawbacks to both of those, and one of those things you'll certainly want to discuss. How can we treat allergies? Well, let me begin by saying this. Anytime we're talking about medications, we always ask you to start with your primary care provider in designing a regimen that is best suited to your child. But some of the more common things you'll see are antihistamines, Claritin, Zyrtec, various things like that over the counter. And then there are prescription medications called Carbinol, Zizol, if you will. Secondly, your intranasal steroids, Flonase, Nasonex, things like that, which will tend to cut down on the inflammation associated in the nose there. And lastly, there is a group of antihistamines, one of the more common ones being montelukast or Singulair. And again, it kind of looks to cut down on the inflammation associated with an allergic response. As far as specialists are concerned, that's another common question. When is it time to see an allergist? Well, it's time to see an allergist when there are special situations, circumstances that are not typical, or you've reached maximal medical treatment and we're not seeming to make any headway. Additionally, if we're thinking about starting allergy shots, another common time to start those or to begin that conversation with a specialist. So on the topic of allergy shots, what's the theory behind it? Well, the theory is if you provide a little small exposure over a longer period of time, you'll reduce your response to that. It is a time commitment, and it can be as frequently as every week to as infrequent as every month, but it does tend to be over a longer period of time. So one of those things you'll want to discuss with your primary care provider. The spring, again, is just a difficult time for us here in the South, and so certainly we recommend seeing your primary care provider when you are experiencing significant allergy symptoms and are wanting to design a treatment regimen around that. You will find a series of these videos on both our website, social media, and newly created YouTube channel, so please check us out there. Additionally, there will be more content to come from more people than just me. Some of our other providers are going to be doing some various topics, and so please check back with us. Thanks.